Hello, I'm Dr. E. Barry Gordon. This video has been divided into two parts because of YouTube length limitations. The intact video can be seen on my website, www.thehiddendisease.com. Hello, I'm Dr. E. Barry Gordon, and this is the 18th video in my series on testosterone deficiency and the second and concluding video on type 2 diabetes. In the previous video, I explained the nature of type 2 diabetes and that testosterone deficiency is a basic integral part of it. I gave my opinion that when it comes to caring for this disease, we live in an era of gross medical neglect because while it is probable that almost every type 2 diabetic is deficient in testosterone, this hormone deficiency is rarely even looked for by the medical community, much less treated. In this video, you're going to hear some of the abundant research that has been published on this relationship. And there are several things to keep in mind as you listen to the results of these studies. Remember that type 2 diabetes or insulin resistance is included in what is called the metabolic syndrome, a group of diseases that are commonly seen together. They include high blood pressure, triglyceride and cholesterol abnormalities, and abdominal obesity. Because of the very common association, many in the medical world make the assumption that all people with the metabolic syndrome also have cardiovascular disease. Remember what I have pointed out several times before. Testosterone deficiency has always been severely underdiagnosed and undertreated. So the findings of all clinical studies on testosterone must be viewed with the suspicion that the effects of testosterone deficiency or testosterone replacement were greatly underestimated. One of the studies that you are going to hear today gives major support to that view. Remember that if you have type 2 diabetes, your testosterone level has in all likelihood never been checked. If you have friends or relatives with type 2 diabetes, it is highly unlikely that anyone has ever checked their testosterone levels either. Finally, much of the language in these studies is technical. So in order to help everyone understand what these researchers are saying, I will substitute simpler words or phrases where appropriate. The unaltered abstracts are on my website, www.thehiddendisease.com. This was the conclusion of a study from Finland, published in the journal Diabetes Care in May 2004. Quote, low total testosterone levels independently predict development of the metabolic syndrome and diabetes in middle-aged men. Thus, testosterone deficiency is an early marker for disturbances in insulin and glucose metabolism that may progress to the metabolic syndrome or frank diabetes and may contribute to their development. Close quote. This study was done in the Netherlands and was published in the May 2005 issue of the Journal of Clinical Endocrinology and Metabolism. It was titled Endogenous Sex Hormones and Metabolic Syndrome in Aging Men. Endogenous means produced in the body. This study looked at the same issue as the previous study, but from the opposite perspective. Quote, higher testosterone levels in aging males are independently associated with a higher insulin sensitivity and a reduced risk of the metabolic syndrome, independent of insulin levels and body composition measurements, suggesting that testosterone may protect against the development of the metabolic syndrome. Close quote. If testosterone protects against the development of the metabolic syndrome, it must protect against the development of diabetes and cardiovascular disease as well. The Journal of Clinical Oncology published this study from Johns Hopkins in August of 2006. The study looked at what happens to men who underwent androgen deprivation therapy, that's severe testosterone depletion, as part of their treatment for prostate cancer. You'll recall that I've twice discussed a 2008 study from Harvard that showed that men treated this way had a 20% increase in their death rate. Quote, These data suggest that metabolic syndrome was present in more than 50% of the men undergoing long-term testosterone deprivation, predisposing them to higher cardiovascular risk. Abdominal obesity and higher blood sugars were responsible for this higher prevalence. We recommend prospective studies to further delineate this association." Close quote. A United Kingdom study on the effect of testosterone replacement on diabetes was published in the June 2006 issue of the European Journal of Endocrinology. Quote, "Testosterone replacement therapy reduces insulin resistance and improves sugar control in testosterone-deficient men with type 2 diabetes. Improvements in sugar control, insulin resistance, cholesterol, and abdominal fat together represent an overall reduction in cardiovascular risk." Close quote.